University of Pretoria's Fertility Unit at Steve Biko Academic Hospital runs an annual program for IVF and other fertility services at a much lower cost than at private fertility clinics and facilities. Now, the programs take patients including women and men struggling with fertility, as well as the LGBTQIA+ members and those who wish to have children but aren't able to reproduce independently. It has now commenced its 2026 programs. Let's speak now to head of the Steve Biko Academic Hospital, head of the Fertility Unit, Professor Zozo Nene. Professor, good morning, and thank you so much for your time.
Good morning, Masichaba, and good morning to your viewers. And thank you very much for the invitation for me to come and talk about a subject that is very close to my heart.
Now, for those who are hearing about this for the first time, Professor, what is the Reproductive Endocrinology and Infertility Unit at Steve Biko Academic Hospital?
Thank you very much for the question. Our unit looks after all the reproductive needs of couples or same-sex couples or single persons, actually. But we don't only focus on infertility. We also look after the contraceptive needs, the adolescent patients' needs, menopause, recurrent pregnancy loss. We look after the full spectrum, and endocrinology, gynae-endocrinology is also part of that because it's the hormonal environment that can affect, the woman's reproductive needs.
How prevalent is infertility, particularly in the community that you're serving?
So what we have now is the World Health Organization data that shows that 1 in 6 couples suffer with infertility. We will release our own data very soon. That's what I've been doing my PhD on, the prevalence of infertility in South Africa, because it has not been studied before. And I feel that we are underestimating infertility as a disease, and hence we needed our own local data. So we'll be publishing that soon. Thank you.
Yeah. Now, IVF is often seen as something that is, which is the truth, unaffordable and something only the wealthy can afford to do. And as much as, we're picking up pace when it comes to the offering of infertility or fertility treatment in public hospitals, Steve Biko Academic Hospital, of course, being one of the first few to do it. And now we have at least 4 public hospitals in South Africa that are providing fertility treatment. But, how does the Steve Biko program change the perception of fertility treatment only being for the wealthy?
Yeah, cost is always a problem when it comes to infertility treatment. But I think it's very important for us to break down what the cost is for. So it might look, if you're looking at absolute numbers, that it is cheaper in the private sector than in the public sector. But if you think about what goes into the cost, there's cost of consultation, cost of ultrasound, cost of medication. And for us in the public sector, this is the biggest cost driver, because medication alone costs about 25 to 35,000, and it's not available in the state. So we prescribe for patients to go and purchase their own medicines in a private pharmacy. So that's what drives our costs. And then it's the cost of the procedure itself, egg retrieval, and then embryo transfer. But in the private sector, they have to include the costs of the doctors, which obviously are a super specialist. So they are not just obstetrician gynecologists. They've trained further to become reproductive medicine specialists. So you know that the tariffs will be different from the different doctors. So it's different for general practitioners, it's different for gynecologists, then it's different for reproductive specialists.
Sure.
Then it's cost of the nurses. Sorry.
Let's actually talk about the costs. I'm glad that we're actually having that conversation. What are the costs, compared to private fertility treatment centers?
So in the public sector, it costs about 25,000 to about as much as 50,000. As I said, the medication is the highest cost, and it depends how much the patient will need. So sometimes they need less, sometimes they need more. And then it's also the cost of the staff. And in the state, it's the government that pays the salaries of the staff. So while in the private sector, they will then add the cost of the doctors, the nurses, the embryologists, and all the supporting staff. So it looks like it is cheaper in the state, but in fact, it is highly subsidized by government. That's why we can offer it at a cheaper rate.
That's fantastic. Now, why is this program classified as a research program? And how does that benefit patients?
So the program is not classified as research. We are offering the service, the clinical service. We do see patients, they come to the clinic, we offer them treatment, and it is evidence-based treatment. We know that the treatment works, although the success rates is something else that we'll probably talk about, but it is evidence-based, and we know, and it has been done globally, and there are success rates for it, so it is not for research purposes.
So for couples who have been trying for years without success, when's the right time to seek help?
So as soon as you are understanding that you are trying and you are failing to achieve a pregnancy, you should actually seek assistance then. But we do say, as per definition, that infertility is when you have been trying for a period of over 1 year, and that means that you are not using contraception and you are having adequate intercourse. But this is for the younger patients, less than 35 years old. Between the age of 35 and 40, then we're not going to wait for a period of 1 year. We want you to come sooner, which means 6 months is the period that you should be trying. If you are not succeeding after 6 months, then you should seek help. But those that have either a known cause of infertility, like they've had an ectopic pregnancy, or they are over the age of 40, because we know that the number of eggs goes down with age. So there's age-related infertility. Those we want to see immediately when they realize that they are not falling pregnant, they should seek assistance.
Now, Professor, fertility discussions often focus on women, whether in the modern setting or even historically in the cultural setting. But how significant is male infertility in the cases that you see?
So the male infertility contributes as much as female infertility. So we say that 30% of the cause is female infertility, and an equal amount, which is 30%, is male infertility. Then we have a combined factor of infertility. Then we have what we say is unexplained. But this is why our unit, we see both couples, because we understand that it has equal contribution between the male and the female for the cause of infertility.
Now, your unit offers semen decontamination for HIV-positive men. Why is this such a groundbreaking service? So
if you understand that we are taking gametes from the female, which is the eggs, and we're taking gametes from the male, which is the sperm, and we're putting it together to make an embryo, which will then become a baby. And then we implant it into the womb of the female. So we need that we must not transfer the HIV virus to the fetus. Hence, we started initially with the semen decontamination procedure because it washes the virus off the sperm. And then we require that our patient must be have a CD4 count that is undetectable and the viral load that is undetectable. So if the viral load is undetectable, now we know that there is something called U equals U. Undetectable means untransmittable. You're not going to transmit the virus. So now we've moved slowly away from the semen decontamination because now we require that the patients bring us their CD4 count and they bring us their viral load, and the viral load must be undetectable, then we are able to assist so that we do not transfer the virus to the fetus.
Fantastic. Professor, thank you so much for your time, and keep up the good work.
Thank you very much.
That was University of Pretoria Clinical Unit Head for Reproductive Endocrinology and Fertility at Steve Biko Academic Hospital, Professor Zozo Nene.